Welcome to this lecture on reversible versus irreversible cell injury in pathology. This is an important topic for undergraduates as well as for those preparing for a postgraduate entrance. So without further delay, let's get started. What happens in reversible injury? There are a lot of changes that happens in reversible injury, but I would like you to remember them by categorizing them by their cellular components. So the membrane or the surface changes. The blunting of the microvilli happens in the membrane or in the surface, it starts with the blunting of the microvilli. Then the cellular blebbing can happen. Loosening of the intercellular attachments can also happen. So the villi which is already formed is flattened, the bleb is been formed, and intercellular attachments are loosened. What about the energy metabolism? There is going to be a decrease in ATP. Decrease in ATP will be present, and because of the decrease in ATP utilization, the glycogen gets accumulated and the fatty change, that is there will be impaired fatty acid metabolism too. Thirdly, we have the changes in the organelles. The organelles will undergo swelling or disaggregation. So mitochondrial swelling will happen and disaggregation of the ribosomes, protein synthesis can happen, but they are all reversible. In addition to it, disruption of cytoskeletal elements inside the cell can happen. Other changes like metastatic calcification, which can lead on to hypercalcemia. So I would like to suggest ideas like you can do a logical or story linking them. So think of a cell under stress due to low ATP, and that is the power failure. The ATP has come down and the mitochondria swell. The factories all break down. So what happens because of the mitochondria swells, the ribosomes disassemble, protein synthesis fails. The structural collapse happens. So those machinery inside the factory like the ribosomes, mitochondria, they all collapse, and the structure, the factory buildings collapses. That's what. So cytoskeleton disruption, membranes bleb, the microvilli will blunt and the cell will loosen. So all this happens. So because of all this, there is a metabolic backlog. So the machinery in the factory is lost. The analogy that is created to make you remember that the ribosomes disassemble and the mitochondria swell. The factory architecture is lost. So that this analogy is used to remember that the membranes bleb, the microvilli blunt, the cell junctions loosen, and there has to be the raw product material has to be processed in the factory. That cannot happen. Therefore there is a metabolic backlog which is associated with fat and glycogen accumulate. So extra effect is that there is metastatic calcification. So all this happens in reversible cell injury. Let's proceed on to the NBME concept, which is the cellular swelling. So in the cell, why should a cellular swelling happen? Cellular swelling happen because of the sodium potassium ATPase pump failure. This is an ATP dependent pump. When there is no ATP, then the pump fails, thereby resulting in hypoxic injury, reduced sodium potassium ATPase activity, resulting in increased intracellular sodium buildup, water retention, as well as cellular swelling. This event occurs before aortic tubular necrosis develops. Okay, so they might even ask you the hydropic changes in the renal PCT, that is the swelling of the renal convoluted cells. Why does it happen? It is because of the decreased sodium potassium ATPase activity. This knowledge can also be applied in myocardium. So the patient dies from MI and the autopsy shows a cellular swelling on cardiac biopsy. The NBME might question you what mechanism explains the finding. It is obviously the cellular swelling is due to decreased sodium potassium ATPase. So the idea behind here is, although cellular swelling and sodium potassium ATPase are technically reversible processes, this can occur in posthumous MI cases. So you should not get confused like the patient has already died. So should I give an irreversible or reversible? It is obviously irreversible but then that stage is reversible. That's what they mean to say. What about the irreversible cell injury? In irreversible cell injury, there is membrane destruction. So plasma membrane disruption happens. thereby resulting in increased permeability and cell lysis. Whereas over there we saw that the blebs happen microvilli blunt and the intercellular junctions are disrupted. But here the membrane is disrupted, resulting in increased permeability. Did you notice they have gone to the next stage? Because of increased permeability, there is cell lysis. So the logical sequence of irreversible injury is that there is severe insult, there is ATP depletion, along with it that is reactive oxygen species also happens. The membrane gets damaged, resulting in leakage, as well as lysosomal enzymes are all released. So once this happens, there is cellular autolysis. So self-digestion by the lysosomal enzymes. So the increased membrane permeability not only happens in the plasma membrane, but it also happens in the lysosomes. Therefore, the digestive enzymes are released and the cell itself is being digested. So what is there in the cell? There is organelle destruction. So what happens in the nuclear changes? Nucleus, it first undergoes nuclear degradation, that is pycnosis, then karyolysis, then karyolysis. That is, the nucleus will first undergo condensation, then the nucleus will undergo fragmentation, then the nucleus will undergo dissolution. The nucleus will not be seen at all. After following that, dystrophic calcification will occur in irreversible cell injury. That is calcification only that is happening in the dead tissue is dystrophic calcification happens. So if you want, I can give you a memory tip like a story. Imagine a cell who has run out of fuel, that is ATP depleted. So now the membranes all rupture, the lysosome membrane also ruptures. Therefore the lysosomes release the digestive enzymes. Because of self-digestion, the nucleus crumbles. The nucleus will undergo pycnosis, fragments, and then it will disappear. Calcium will precipitate. So on that side it looks as if that is a temporary stoppage, but whereas over here everything, the permeability increases, everything undergoes dissolution, and then finally the death as well as it becomes lysed. That stage is irreversible cell injury. I hope I have made this clear, and I hope this is of help to you. Have a good day.